To cut or not to cut, that is the question. With apologies to Shakespeare's Hamlet, I'm here today to speak about a medical condition which prompts that very question. The condition of which I am going to speak is what's known as Ankyloglossia. This mouthful of a word is actually the medical term for somebody who is tongue-tied. I'm going to speak about Ankyloglossia, define it, and discuss the problems that an infant has when they're attempting to breastfeed with this condition, and the problems that it poses for children as they develop and have speech problems later in life. Ankyloglossia, as I mentioned before, is the condition what's known as being tongue-tied. This has been around for thousands of years. The Bible even mentions it in Mark chapter 7 verse 35. It states, "And his tongue was loosed and he did speak." Researchers put it at about 5% of all infants who are born with this condition. The problem is there's no standard definition in the medical community about what this is and how to define it. But Doctors Kazi and Gangadhar made a list of some of the more common characteristics of a person who has this condition. It says it can appear forked, resembling even a serpent's tongue. Obviously the limited mobility of the tongue is also a clear-cut sign of this. This picture demonstrates a person who suffers from extreme ankyloglossia. You'll notice the frenulum, which is the cord that attaches the tongue to the base of the mouth, is located in this person quite near the tip of the tongue, as opposed to the center of the tongue where it normally resides. This, of course, restricts lingual movement quite a bit and impedes a person from sticking their tongue out of their mouth. I stated earlier that 5% of all infants born are born with ankyloglossia. And Dr. Kumar notes that 1/4 of the children born with this condition experience trouble when they're trying to breastfeed. This can prove very serious for a newborn when they're trying to learn how to breastfeed and need that nourishment in order to grow. And one example of a solution is what's known as a frenulectomy. A frenulectomy is a procedure that is done in a doctor's office. The patient is brought in, a metal tool is placed under the tongue to lift and immobilize it, and then the frenulum is quickly released. Another study notes that approximately 70% of the infants who received this procedure showed immediate and marked success in improvement in breastfeeding. This provides a great relief to the parents and is a very attractive option for infants who are experiencing these difficulties. Many children who are born with ankyloglossia do not have the frenulectomy performed, and they go through life with this tongue tethered to the bottom of their mouth. In many instances, children develop speech problems, and ankyloglossia is the #1 culprit suggested for why this happens. It makes sense that if your tongue is limited in its mobility, it would produce some speech problems. However, the medical community is quite divided about whether this is the case. In fact, no empirical evidence has ever been proved to form a relationship between speech problems and ankyloglossia. Dr. Kumar again notes that all of the vital sounds that the tongue makes, the TH, the S, the R, for example, can be made through alternate placement of the tongue in a different part of the mouth, through speech therapy, and through practice. Doctors Mira, Brinkman, and Riley also mention that there is no clear indicator for either the necessity of the surgery or for the post-surgery results. In other words, no benchmark has been established for when this should be done or what should be the result after it is done. Ankyloglossia is a condition which affects thousands of infants every year. For infants who have trouble breastfeeding, a simple surgery can provide immediate relief and success. And while the medical community has yet to establish a relationship between ankyloglossia and speech problems, a frenulectomy can provide greater lingual movement, and in the words of Dr. Kennedy, can allow a child to be more socially accepted through being able to catch snowflakes on their tongue, or play a wind instrument, or lick an ice cream cone. So to answer the question that I posed to you earlier, to cut or not to cut, I believe the choice is quite clear. Does anyone have any questions?
How painful is the tongue release surgery?
It's nearly pain-free. In most children it's done without anesthesia, and the surgery rarely results in bleeding. Any other questions?
How is a child who's tongue-tied unable to breastfeed?
Well, because a child with ankyloglossia is unable to bring their tongue all the way forward, can sometimes not include it when they're compressing their mouth around their mother's breast. Normally you use your tongue and the upper gum, but in this case it would be the upper and lower gums which try to express the milk from their mother's breast. This can produce two things. It can produce an inefficient latch and an inability to express the milk, and then it can also be quite painful for the mother.